fertility. Some people care about it, some people don't. Some people care about it later, some, whatever. Anyways, so one of the things we try to address with people getting onto hormone therapy is fertility. Sometimes people don't want to discuss it at first, and they may want to discuss it later. Either's fine, whatever they're comfortable with. One thing just to know quickly up front is that there is not a lot of research, and there's certainly not a lot of long-term research looking at fertility in transgender individuals who go on hormone therapy, whether it be estrogen or testosterone. The studies that are out there are promising, however, and most of this video is going to be me explaining what my experiences have been with our clinic, which sees only transgender people, so we see hundreds and hundreds and hundreds of trans folks. And so we have seen scenarios where people decide they want to conceive after they've been on hormone therapy and yada yada. So anyway, starting off, one of the things to consider whenever you are getting on hormone therapy is what your baseline fertility is. There are people out there who are already infertile at baseline, for example. So it wouldn't matter how long they're on hormone therapy or if they went on hormone therapy at all, they'd still be infertile no matter what. So if you want to get checked for your fertility before going on hormone therapy, there are ways to do it. Just in brief, if you have ovaries, you're probably going to want to see an OBGYN or reproductive specialist, which is usually going to be an OBGYN who specializes in reproductive medicine, but anyway. And there are certain hormone tests they could run that are fairly easy, but they're still not going to be able to say 100% just because you have certain hormones that, the eggs that are there are good to go. Another thing they can throw in there is kind of an ultrasound where they actually look at the follicles that are there. And those things together can give a better picture. However, nothing's fail-safe. Life is crazy. So even still, things can end up not happening for you later on. And even the most fertile of people can have difficulty conceiving anyway. So please know this up front. For those who have sperm, you can get your fertility evaluated a little bit easier by having just a sperm analysis done. This can be done either at a fertility specialist office, or there are actually mail-in kits that you can order. I'll talk about a company that I refer patients to fairly often for that a little bit later towards the end. But anyway, it's basically you send in a sample, they'll analyze the amount of sperm there, the movement, and all that stuff, and kind of give you a report. And just give you a good idea of baseline fertility possibility, because like I said, nothing is for certain. And even if you yourself are fertile, your partner may not be, so there's also that other part to the equation. At any rate, my nose itches. So moving on, know your baseline fertility if it is that important to you. Anyway, so next, just kind of briefly talking about what hormone therapy does to each type of person, like testosterone, estrogen, ovary, sperm producing, those kind of things. So with regard to those who go on testosterone, who generally are going to have ovaries, but hey, they may have had a hysterectomy, or they may be intersex and not have them, whatever, but we're talking about more the mass of the population here, where going on testosterone, you're going to have ovaries most likely. So when you go on testosterone, it essentially is going to put your body through menopause, this part of your body anyway, the uterus and ovaries, not the rest of you. But when cis women go through menopause, they eventually become infertile, and that's because all of this downstairs is shutting down, essentially. The same thing is going to happen with testosterone. You're going to see atrophy of the uterus, atrophy, of the ovaries and everything there, and usually a ceasing of the cycle, but not always. 20-25% of trans masculine folks still have one. Anyway, so usually you're going to see that stuff slow down or be altered in some way, and then get some atrophy as time goes on to the uterus and whatnot. So That's for those on testosterone. For those who go on estrogen therapy, who presumably produce sperm, but like I said, there are cases where people may not for various reasons, but again, this is talking about the mass of people. The majority that are going to be going on estrogen therapy are likely going to be sperm producing individuals. When you go on estrogen therapy, if you're doing full dose, that is, I should have mentioned that before for the testosterone people as well, if you're doing full dose therapy, meaning full speed ahead, full transition, all the either masculine or feminine features, you're going to be on the higher dose than someone who's doing like non-binary therapy, and so it's a little more heavy hitting. The non-binary people are a little less heavy hit, but they still do get hit. But anyway, so those going on estrogen therapy are going to experience atrophy as well in the downstairs area to their genitalia, and also to the area that produces the sperm in the first place. And one of the things that happens on estrogen therapy is your testosterone levels drop. And when these drop, sperm production just goes out the window, basically. Now, that doesn't mean that you don't have a couple just floating around in there. So, I mean, you can't count on this as like birth control, for sperm producing individuals. That also goes for those who are transmasculine going on testosterone. Not a guarantee. It may slow things down and make it more difficult to conceive. But if you are someone with ovaries and you're having sex with a sperm producing partner, be on some kind of birth control. Anyway, same goes for those who are sperm producers who are having sex with those who have a uterus and ovaries, so that technically they could conceive. Y'all don't need to count on estrogen being your birth control method. You need to rely on something else, because all it takes is one of those little things getting through there, and then guess what? You're a parent. And if you're not ready for that, don't do it. Anyway, so atrophy for either those on testosterone or estrogen therapy, and you're going to see, changes with the reproductive systems in both of those, where you see a slowing down of them both, but it's not birth control. Anyway, so those are some physical changes. I have other videos that kind of discuss those more in depth if anybody's super bored and wants to hear about that. But anyway, so let's say you go on hormone therapy, and then later you're like, I really want to have a kid of my own biologically, and so what do I do? So essentially what you're going to have to do is come off of hormone therapy for a time. Usually to return to some type of fertility, it's going to be a bare minimum of 3 months, but it's usually going to be more like 6 months, maybe more. It really depends on how long you've been on hormone therapy and what type you're on as well. So, if someone is a sperm producer and they want to just go off of estrogen therapy, usually you can start producing sperm again relatively quickly within 3 to 6 months or so, from my experience with my patients in the clinic. And so then if you would like to try, the natural way, or if you're just having it collected and doing in vitro or something like that, then you would be able to do so. Clearly, it's not as easy for those who are bearing those ovaries and uteruses. They would have to go off of testosterone for probably 3 to 6 months. And or there are fertility specialists out there who can put you on, whether you're a sperm producer or egg producer. There's some fertility meds that can be used to help speed this process up, just FYI. But those with a uterus and ovaries are likely going to have to be off of it for around 6 months or so before they, could potentially see results of their trials. And of course, after that, should you conceive, you still have to stay off of hormone therapy while you are actually carrying a child, because testosterone is considered a teratogen, which is basically poison to a developing fetus. So you need to stay off of testosterone for the time that it takes to regain fertility, and also for the time it takes to carry the child to term, give birth and everything. And, you know, after that, there's a little bit of different discussions about whether or not breastfeeding and chest feeding is going to be good for those, depending on who's doing it. I mean, if you're transmasc, you're chest feeding. If you're trans femme, you would be breastfeeding. It's kind of up in the air about being on hormone therapy and doing that. Whether it's got any kind of ramifications for the hormones passing through the milk. What it looks like is that not enough passes through it to be harmful, but not really enough studies there to say for 100% certain. So that's something that you definitely have to discuss with your OBGYN/fertility specialist there. So anyway, sorry, I tend to ramble all over the place. So whether you are breastfeeding, chest feeding, if you're planning on going on hormone therapy, while doing this, you need to discuss this with the OBGYN, pediatrician, fertility specialist, or whoever, so they can look up the latest and greatest on this practice to make sure that it's not going to have any kind of ramifications for your baby. Clearly, the safest thing to do would be to, you know, do the chest or breastfeeding for a period of time before going back on hormone therapy. But if it is a situation of, you know, psychological danger to yourself, mentally and everything from staying off of hormone therapy, like I said, clearly this is something you need to discuss with your provider. At any rate, so it is possible. That was a really long answer to a lot of people's question of, can I go on hormone therapy and then later come off and possibly, you know, have a child? And so the answer is, you know, yes, I have seen this happen very many times with current patients. And, you know, the research that's out there is positive leaning, but it's also very small, and there are no, like, just long, far out studies. It's very short term, you know, a year or 2 years or something like that, where they're looking at folks who were trying to regain fertility and conceive. So what are some factors that might affect fertility whenever you've been on hormone therapy? So there's a lot of things to take into consideration. Your age at time of hormone therapy initiation, and then at the time that you decide to stop, because clearly if you decide to go off of hormone therapy and you're 58, probably going to be a little bit more difficult to conceive, whether you're a sperm producer or an egg producer. And then the amount of time that you've been on hormone therapy. So, you know, if you have been on hormone therapy for less than 5 years, I'd say your chances of going off of hormone therapy and, you know, regaining fertility are very good. Of course, like I said, I mean, if you went on hormone therapy at age 50 and you come off of it at age 55, you're not going to have a 20-year-old's fertility, you're going to have a 55-year-old's fertility, so be realistic, you know. And so your overall health as well, something else to look at. You know, clearly if you have a lot of comorbidities, such as, let's say you have, God, I don't know, diabetes that you're not really doing anything about, it's not well controlled, you've got high blood pressure, you've got, I don't know, uncontrolled asthma or COPD or CHF or kidney disease or liver disease or whatever. Just all these things, you know, go together to make the picture of your overall health. And I mean, if you're not overall, at least generally healthy, there's not like magic here that's gonna make you conceive if your body is not healthy enough for it. So your baseline fertility, of course, like I said at the beginning, is something to consider. If you were infertile to begin with, it's likely not going to change when you go on hormone therapy and then go off. If you go on hormone therapy and stay on it for 20 years, that's a long time and a lot of atrophy of those reproductive organs that could occur. If you go on hormone therapy at a later time in life, such as after 40, after 50, after 60, You know, of course, this is probably going to be more for the sperm producing folks, for those who are after age 60 looking to conceive a child after that. But again, you know, if you go off of hormone therapy when you're a little bit later in life, you're going to have decreased chances of fertility. If you went on hormone therapy super young, like if you're one of those folks who was in a state where you could actually start puberty blockers and then hormone therapy at the very beginning part of puberty, there's not a lot of research out there, and I personally don't have any patients that I have seen come through and do this who went on hormone therapy or puberty blockers and then hormone therapy later, where they had not even, like if they were an ovary person, they had not even yet had a cycle, and if they were, you know, a sperm producing person, other certain things that happened with them had not even happened yet. And so you put them on puberty blockers and hormone therapy, those organs had not yet reached their own puberty and their own, you know, fruition, so to speak. They had not matured. And so it's kind of up in the air for like those few studies that are out there pondering this, whether or not if you come off of hormone therapy, does everything just go okay and start kind of kicking back on slowly, and then will it just mature those organs to a point where, you know, fertility resumes? We just don't know. It seems likely is about all I can comment on for those who have done that, you know, whenever it was just at the start of puberty and they got to go on those blockers and then later hormone therapy. So, you know, sorry, I don't have a lot of advice for you, but if you go on it young, and I mean young like 18, 19, 20, you know, your reproductive system is pretty well developed and done. You know, it's cooked at that point. And so, you know, if you come off of hormone therapy later on, you have a better chance than, supposedly, than of regaining fertility with all these other things combined. Like I said, overall health, baseline fertility, the length of time you stayed on it. Because, you know, if you went on hormone therapy at age 19, but then come off of it at age 50, but if you go on at 19 and come off at like 28, okay. I mean, in my personal experience, I have not yet seen anyone who has been on hormone therapy for greater than 10 years come off of it and try to conceive, you know, a child. Not because, you know, it doesn't work. I just have not seen it in my practice as of yet. So those that in my practice that I have seen come off of hormone therapy, the vast majority of them have been on hormone therapy for less than 5 years, and then several others have been, you know, 10 years or less, somewhere between the 5 and 10 year mark. So to sum up, their baseline fertility, get it checked if this is a very important topic to you. And then also be aware of the effects that are going to happen to your reproductive system while on either testosterone or estrogen therapy, and then be aware of the various factors that can affect your fertility overall, such as your age, either at time that you start hormone therapy versus also the age at which time you decide to come off of hormone therapy to conceive, then the length of time that you were on hormone therapy before you decided to come off and conceive, as well as your just overall general health, and like all those things, just kind of, it's multifactorial. Nobody's got a crystal ball, but if this is something very important to you, I would definitely suggest getting in with like an OBGYN fertility specialist to get an evaluation done and get their advice. Now, like I said in the beginning of the video, there is a company for those who are sperm producers that I often refer them to online to check out. Just as a starting point, like, I don't know this company, they don't know me, I'm not getting anything for putting their name out there or anything like that. But the company's name is Legacy Fertility. That's legacy, like I leave a legacy or something, and then fertility. So Legacy Fertility, and they do sperm analysis to tell you, you know, what your fertility is, you know, how good all the little sperms are looking. Are they moving around? Are they laying there? And how high is the count? And they also do sperm storage or freezing. And they have many different packages, and the only reason that I mentioned this company to people, one, as a starting point so they know that there are a lot of companies out there just like this. So there are many different options, but one of the reasons I mentioned this one first is just because on their website they actually have an LGBT family section, and I just thought that was a really positive thing to see in a company, that they would put that as one of their main pages on their website. A lot of companies are kind of scared to do that, so I did like that. But just be aware that, you know, sperm analysis, sperm freezing, stuff like that, and storage is usually going to be a few $100s. It's not something that's like $1,000 up front, but I mean, you know, somewhere between like maybe, I don't know, $300 to $500, and that usually includes stuff like the analysis of the sperm and the first 1 or 2 years of storing it or something like that, and then they have like a different per year, or you can buy so many years. So it's something that if you wanted to, you know, freeze sperm and just be like, well, unless I decide in the next 5 years, you know, and just buy a 5-year package or something like that, and if at the end of 5 years you're like, then you can just let it go. Anyway, so definitely something to check out. There's lots of these companies online where you can do the mail order stuff. And Legacy Fertility, like I said, is just a starting point that I point people to because they have that one positive aspect on their website. Now, for those who are egg producers, it is, of course, a little bit harder here because we don't, when it comes to ovaries and stuff, it's not as easy to kind of see the end product there. So you're probably going to have to seek out an OBGYN fertility specialist, and if you were wanting to freeze eggs, you know, they usually call it like egg freezing or egg harvesting or something like that. And it is a procedure that usually they can do in an office setting. And it's, well, I mean, medically speaking, it's a relatively simple procedure, but it generally is going to be much more costly than just freezing sperm. So you're talking usually somewhere $1,000 to $3,000 or $4,000 even for the cost of seeing the healthcare professional, having the procedure done, having the eggs either analyzed or just straight up, you know, frozen, and don't bother to analyze them. There are a variety of OBGYNs out there that offer this kind of service. I don't really have any specific one to point you to, you know, especially since I get people watching these videos from all over the world. So I really don't know where to point you to, since I'm sitting here in, you know, Mississippi. So telling you where to go in Mississippi is probably not going to help someone who's in like Bangkok or something, you know. Anyway, so anyway, hopefully this gets you a little firmer grasp, as random as it was with me bouncing all over the place. But I hope it gives you a firmer grasp on what's available, what happens, and that, you know, it does appear, but it's not 100% guaranteed, but it does appear that there is some reasonable expectation of success when it comes to regaining fertility, you know, especially if you're younger when you go on HRT, younger when you come off of HRT, and you weren't on HRT for, you know, very long, and if you have decent health, then it does look very positive for you to be able to conceive. And like I said, there's also these fertility drugs and stuff that you can be given that can help kind of speed the process along and ripen those eggs or whatever a little bit quicker. Anyway, so hope this helped someone out there, and y'all have a fun day. Bye.